what I like to do first is just do a little bit of ice pack. This is platelet-rich plasma for rejuvenation of eyes, or as we like to call it, the vampire eyes. And it tends to be real sensitive there because there's so many blood vessels that you end up getting bruising very, very easily. So we try to do a little ice first to get ready for it. We do it, I try to do, depending on which machine, if this were like the Eclipse or the Regen, I would do 1 cc per eye and just overfill it. But since this is the Magellan, we're going to do 0.5 per eye. People feel a burn sensation, so we're trying to help them out with that. And then immediately after we put ice back on it, I think the key to it is that you really have to overfill it, because as it reabsorbs back into the skin, it'll actually start to fill the little sulcus up. And
so
that's the main thing.
You're putting a whole cc per eye.
Right, but that's with the Regen or the Eclipse.
Okay.
With this
and
one,
they're not looking puffy when they go on?
no, because we do a little eye. We help them out a little
That's
bit.
A good tip.
Now, if we hit a blood vessel and they're bruised, then yeah, they're puffy. And they're stuck with the bruise. They've got a shiner for 3 to 7, 10 days. So there's always that risk, I'm telling you now. But you can cover it with concealer and makeup or whatever you have to. And the guys do wear concealer if they have to. So you always stress to them that this is what might happen, so that's what goes with it. You're nice and cool? Okay, let's get started. And so, I always just make sure my bevel is up. And then here we go. I'm just going to go real gently. There we go. In. I'm pushing it in now. And you're going to feel it. Should have a nice little burn or tingle, right? But it's minimal.
And you're just subdermal?
Yeah, just right up underneath the skin.
Yeah, unlike the fillers where you have to worry about the blue tint and all that, with this you can just be subdermal, no
Here we
problem.
go. And you're going to fill it.
Probably because of the blood in this particular kit, it probably will look a little bruised.
Yeah, it will. It's going to have a little tinge to it. And you can see it's already kind of overfilling. And then we just go on over to the side. And the patients that make you go real fast, you just tell them, you're going to bruise.
Are you going along the orbital rim right now?
Correct.
That's where your starting point is?
Correct.
Below the rim, above, or at?
Right above it. And then I always like to get the proverbial crow's feet. And we go right into it. And this one's just to really sub. And again, you're going to feel the burn.
Just a little bit more as the tissue warms.
Okay, last
First one I didn't feel.
And you can see I'm already at a half, and I could put a whole lot more in, but I don't want to take up all of his PRP. So anyway, that's what I do for platelet-rich plasma for eye rejuvenation, or vampire eyes, as Dr. Reynolds would like to call it.
All right, well, we just finished doing a vampire base lift. And then Dr. Haynes was kind enough to show us how she treats some of the darkening of the eyes, the bags that you get under your eyes. And so we just finished that. And how was everything?
It was good.
Felt okay?
A little bit of pain, but it wasn't terrible.
It wasn't terrible. Great. And we're looking forward to some great results here in the future. Dr. Haynes, thank you so much.
Thank you. And thank you so much for letting us do this. Hopefully your vampire eyes, you'll enjoy it. It was a pleasure doing you, and you're just so much fun.
Appreciate it.
Thank you guys.